welcome you to our live event tonight. I'm just going to forewarn you that I am by myself. I normally have someone that feeds me the questions, but all the staff had other commitments, and so I'm all alone. I hope I am able to get to as many of your questions as possible, quickly as possible, but I'm looking forward to being with you. I hope that tonight will be enjoyable, profitable for you. One thing nice about learning, when you learn about Medicare, not only does it help you to make great decisions, but also helps others as well. And so that's really a twofold benefit. So tonight I hope you learn a lot. I do want to let you know that I am going to speak a little bit about this topic about the checklist, because we think it's very critical that you're aware of what's going on as we move into 2026. And then I'll take the questions then for probably an hour, hour and a half, hour and 15 minutes, something like that, as long as I can last. But if you want to start putting your questions in, do me a favor, please. Make sure I can understand your question. Sometimes people are so abbreviated that I do not understand what you're asking. So if you could be clear on the question, that way I can respond to it. You can ask anything about Medicare, of course, about Social Security as well, if you'd like to discuss those topics. All right, we're going to get started. You can see the kind of the theme of tonight. We're going to begin by talking about this Medicare checklist. And there's 5 items, actually there's more than that, but these are things that you need to check off to make sure as we roll into 2026 that you are prepared. So let me break it down this way. Let's talk about those of you that are already on Medicare and you have a supplemental plan and you're going to keep that supplemental plan. If that's the case, then I know that you also have a standalone prescription drug plan. When we go on Medicare, we can get our meds covered either through an Advantage plan, which means it's included, or if we stay in the original Medicare system and get a SUP, then we have a separate or a standalone Part D plan. So let's deal with that first, because I know some of you watching this have supplemental plans. So make sure that kind of the checklist would be, make sure that you are aware of what your plan is doing for the coming year. Folks, I've talked to many people already who have said, well, Marvin, I liked my plan last year. I'm just going to let it renew and not worry about it. And I've heard that many times. And folks, that's not wise. You want to make sure that you know exactly what your plan is doing. Now, it could be that that plan is going to be in your best interest, but please do your due diligence to make sure you're on the right Part D plan. So what you have to be paying attention to is, what did your plan change? Some of the plans this year took the maximum increase in premium that the government allowed. It was $50. In most markets right now, we have anywhere from about 8 to 12 plans, and about 25% of those plans took that max increase. So you could have been on a plan that was $19 this year, and now it's $69, or you're on a plan that was $38, and now it's $88. And so I've seen those kind of adjustments because the government said they could raise it $50, and some took the full increase. Now, some did not. They just took slight increases. We actually saw one plan that decreased. We actually saw 2 plans being eliminated fully. So just be aware of what your plan is doing. So do your due diligence. Now, the best way to do that now, and this has just changed here in the last couple weeks, best place to do that would be through Medicare.gov. We used to have our own system, but the insurance companies started removing those Part D plans from our platforms, and this has happened to brokers all over the country. So today we're really stuck with going to Medicare.gov. I feel like our system was tons better. It was laid out better, more information, more understandable. But when the insurance companies did that, along with some of the government changes, now we have to go to Medicare.gov. So you can go to Medicare.gov, put your meds in, the dosage frequency, the pharmacy choices that'll hold up to 5, and look at those plans. And if your plan is still the number 1 plan, do nothing. It will automatically renew. But if your plan, I just had this happen, had a guy whose plan he's on this year is now in 2026 in the 3rd position, because what they do is they take the plans and they put them in order of cost and coverage. And you want with a plan that's going to give you the best cost and the best coverage. And his plan that was number 1 is now number 3. And so he got off that plan, of course, and enrolled into the best plan for him for this year. And so be sure you're paying attention to the premium. Be sure you're watching the formulary? Are all of your medications covered? Pay attention to the copays, because some of these plans, last year they had a tier 1 medication, now it's a tier 2. Where tier 2 bumped to a tier 3 or tier 4. And so we've seen some tiering adjustments, which means those medications may cost you more. Also, some of the plans are charging co-insurance at certain tiers. So if that medication costs $200, you're going to pay 25% co-insurance instead of a flat copay. So all I'm trying to encourage you to do, check the box off once you know you've done your due diligence to be sure that you're on the right drug plan. You know the premium, you know the formulary. Be sure to also check your pharmacy. Make sure the pharmacy that you want to go to is a preferred pharmacy, meaning it gives you the best prices. Because there's 2 types of pharmacy, standard and preferred, and usually standard is a little bit higher. Not always, but usually. So pay attention to that as well. And so that would be number 1, make sure you're on the right prescription drug plan. Now, number 2, if you happen to be someone that is on expensive medications, expensive meds, meaning your meds are retailing for $5,000, $10,000, $20,000, $30,000 a month, then I want to make sure you know that the big thing for you is to make sure that your medications are in the formulary. No matter what they cost, if they're covered, the most you'll spend in 2026 is $2,100. This year, that was $2,000. Big, it didn't go up much, 5%. So this year, no matter, as long as the medication was in formulary, the most you'd ever spend would be $2,000. Next year, it bumped up to $2,100, as long as it's in formulary. So that's why I'm saying make sure your med's in formulary. That way, they'll fall within that max cap. Now, sometimes people are unable to come up with that initial $2,100 on month 1. Even though that's what they're going to have to pay. If they can't pay that, then what you can do is you actually can enroll into a Medicare prescription payment plan. Every Part D plan will make that available to you. Now, when you enroll in a prescription payment plan, folks, you're not saving money. It's not a money savings tool. What it is, it gives you the chance to spread out that $2,100 over the year instead of having to pay for that the first time you go in to get a fill if you're on expensive medication. So again, it smooths it out, spreads it out. So I would encourage you, once you've selected your drug plan, then be sure to enroll in that as soon as possible so that when you go to get your medications January, that they'll fall underneath that new program. Now, if you stay with the same plan, I think that prescription payment plan also auto-renews. I'm not 100% positive about that, but I do believe that if you switch plans, you do have to re-enroll into that company's payment prescription plan. Okay, so if you have expensive meds and you know you're going to meet the $2,100, don't have that up front, then smooth it out. Now, if you can pay the $2,100 up front, then you're done for the whole year. You won't have to pay for any medications the rest of the year. Okay, so that's really the easiest, but if you don't have the cash flow, then I'd enroll into that particular plan. All right, so those are a couple items. Now I want to talk about MAPD plans versus MA-only plans, because MA-only plans have become very popular here in the last couple of years. So let me tell you the difference so that everyone's clear. If you have the ability to get your medications through another credible source, credible coverage, typically the source would be VA, TRICARE, or FEHB. FEHB means Federal Employee Health Benefits. So you're retired civil service, you have insurance through your retiree plan with the government. If you have drug coverage there, or you're retired military, you have TRICARE, or you have VA benefits. And TRICARE and VA is different. VA means someone served in the military, but they didn't retire from the military, so you use the VA. But all 3 of those sources are credible drug coverage. They're as good as or better than Medicare Part D plans. So if you can get your meds elsewhere, VA, TRICARE, or FEHB, then you can enroll into an MA-only plan. MA-only plan. That means you have your medical covered, inpatient, outpatient, just not prescription drugs. And so the reason I'm mentioning this is because those have become very attractive in that what happens when you enroll into an MA-only plan, the insurance company, that Medicare Advantage company, does not have to cover your meds. So what they'll do is they'll take some of that fee they get. It's called capitation. They get that capitation fee, which is per member per month, paid by the government. they get that money and they can take some of that and they will give that back to you as a credit towards your Part B premium. They're not going to write you a check, but if you're on Social Security and you get that Part B reduction, that give back, then that increases your Social Security check. Now, if you're not on Social Security, then you still get it back, but you get it back by way of them reducing your Part B premium. So again, this MA-only plans have very attractive Part B givebacks in 2026. So don't miss out on that if indeed you have another credible source. Now, if you don't have a credible source, you can still be on an MAPD plan. It includes prescription drugs, and they may still give you a small give back. But I always encourage people, when you see the give back coming on an MAPD plan, just make sure you're not just focused on just the give back. Focus on other aspects of the plan. Are your doctors in network? What are your copays? What's your max out of pocket? So do pay attention to all those details if you have a give back on a traditional MAPD plan. If it's MA only, I know it's going to be very attractive for sure. Okay, so that would be something I'd want to check off as well. Now, in addition, this year we've seen some fairly sizable increases on Medicare Advantage plans when it comes to the max out of pockets. Max out of pocket is an annual amount that you have to pay, or the most you'll have to pay during the year. And then once you hit that max, whatever it is, then the plan pays 100% of the cost. And then in January, that max out of pockets resets. And here's what I'm trying to teach you. On your max out of pocket, some of them have gone up to $9,000, $10,000. Some of them are $5,000 or $7,000. And if you do not have the money to be able to pay that max out of pocket, what I would encourage you to do is to look at what are called indemnity plans. They call them HIP plans, hospital indemnity plans. They're also called copay protection plans, because what they will do is they will give you lump sum amounts to pay some of your copays. Use the emergency room, ambulance rides, and hospital copays. That's the big one. And so if you have a hospitalization and it costs you $400 a day for 6 days, that's $2,400. And if you don't have that, you can buy one of these hospital indemnity plans, and it would cover all of those copays for you. And so we want to make sure that you're aware of that, because they're very low cost. Sometimes there's some minor qualifications, sometimes not, but we write those. If you don't have someone you're working with, call us. We'll help you to get all of that set up. But again, those are called copay protection plans, hospital indemnity plans. They're synonymous. And then critical illness plans are also a good idea if indeed you can qualify. Critical illness means you've been diagnosed with cancer, you had a heart attack or a stroke. And if you have those health conditions, then you again get a lump sum to help offset some of those max out of pocket expenses that you're probably going to reach, especially if it's cancer. So this would be a great time of the year to be adding those. So you can check that off your box as well. Okay, now, lastly, I want to talk about the Part B premiums. We know that they're going to go up. We're not sure exactly what it's going to go up to. Most people are saying now probably $185 is going up to $206.50. That's a pretty reliable number. It may not be right there, but hopefully we'll get those numbers soon. But it's going to go up. And so I want to make sure that you know that when they establish the Part B premiums, they're establishing it from your 2 years prior income. So this year, you're on Medicare 2025, it came from 2023 income. So 2026, they're going to look back at 2024. And so we do not know what the income thresholds are yet. This year, single is $106,000. Married couple filing a joint return is $212,000. If we stay below those thresholds, we don't have the surcharges, the IRMAs. But if we're above them, then we have IRMAs. And so I'm sharing this with you because I want you to know we are anticipating those thresholds to go up some. Again, we don't know what it's going to be. Maybe 110, 112 for a single, probably double that for a couple, 220, 224. Hopefully those will be announced sometime this month so you can prepare for IRMAs. And so right now there's 5 levels of IRMA. I assume there will be 5 levels next year. The low IRMA this year is about $88 a month. The high IRMA is about $527. I would suspect those are going to go up a little bit as well. But remember, if you've had a qualifying life-changing event and you have an IRMA, and this qualifying life-changing event has happened in the last 2 years, you can appeal the IRMAs. You can ask the government to stop looking back 2 years. In other words, if I'm on Medicare in 2026 and I have an IRMA, if my income was different in 2025, or it will be different in 2026 because of a life-changing event, death, divorce, marriage, work stoppage, work reduction, then you can give them new numbers. They automatically look back 2 years, but if you had a life-changing event in the last 2, you can give them 25 or 26. And they'll look at those, and you can appeal the IRMA. They'll drop off the IRMAs, or at least reduce the IRMAs. So be sure to take your time in appealing those IRMAs once you get that IRMA letter. You can't appeal until you get the letter. And I know the letters haven't come out yet, but they will be coming here hopefully within the next few weeks or so. All right? So I want to make sure that if you have an IRMA, you check that off the box if indeed you're able to appeal the IRMAs. All right, so hope you've done your due diligence. Lastly, before I get going, I want to make sure everyone knows that if you're on a MedSup plan, MedSup plans have nothing at all, folks, to do with this period of time. Nothing. Okay, this period of time, October 15th to December 7th, is all about Advantage plans and all about prescription drug plans, because those are one-year plans. MedSup plans are lifetime. So we've had lots of people ask us, well, what's my premium going to be next year? We don't know. You don't know yet, because premiums don't necessarily increase at this time of the year. Most MedSup plans increase their premiums at the policy anniversary date. We call that the effective date. So if you went on your policy July 1, you're not going to know about a price increase now. You're going to hear about that in May or in June, 30 to 60 days in advance. Now, if your MedSup anniversary date is January 1, then coincidentally, you're going to hear about that now. But again, it's tied to the anniversary of the policy, so just know that. So MedSup plans have nothing to do with this period of time at all, other than if you want to move from a MedSup to a Medicare Advantage plan, then this is the only time of the year you can do that. So if you can no longer afford or don't want to afford a MedSup plan and you want to move to a Medicare Advantage plan, we'd be happy to help facilitate that switch. But again, you have October 15th to December 7th to do that. There's no underwriting involved. We just simply have to check docs for networks, your pharmacy, your prescription choices, and make sure that you're going to be on the very best Advantage plan for you if indeed you want to make that switch. Now remember, you have networks to deal with. You have pre-authorizations that'll be new for you. You have annual policies now, so there are definitely differences in MedSups and Medicare Advantage, but sometimes people come to a place where they just simply cannot afford a MedSup any longer or don't want to, and going to that Medicare Advantage plan would be a much better step than going to A and B only for sure. All right, so this would be the time of the year to do that. All right, so I've rambled enough. Hopefully that's been helpful information. If you have any other questions that I didn't address, certainly you can put those in the chat, and I'm going to start answering questions. Now, for those of you that just joined in, I want to make sure you know that I am by myself, okay? And so I'm going to start going through your questions. Okay, now can you see me? Okay, hang on just a second. Okay, if someone could put in the chat if they can see me, I would appreciate that. No audio, no video. That is thrilling. Wow. Okay, can see you. You're back on. Great, great. I am so sorry. It's not shocking this happened. Here we go. Let's get going. Let me go to the top, and I'm going to start. Okay. The first one that I can see here says, I'm interested in supplemental plan. Okay. Okay, hang on just 1 second. Let me get back to the top of the questions, and we'll get going. Okay, I'm interested in supplemental plan. Here we go. Just turned 65, still working, covered by employer insurance. Do I still have to sign up to avoid penalty? What happens with the change to being 67? Okay, first off, Wendy, as long as you're covered by a plan that has 20 employees or more, you do not have to do anything at all with Medicare. Okay, 20 employees or more, and that would be on the payroll. So you don't have to do anything at all. Now, if there's 19 employees or less, then yes, people have to go on Medicare A and B at 65, but 20 or more, you don't have to. Now, I would encourage you, as long as you don't have an HSA, I would enroll in A only. Those of you with HSAs that are going to continue to work and you want to contribute to your HSA, don't do A and don't do B. Do nothing at all. Okay, but those that don't have an HSA, health savings accounts, then I'd enroll in A only. So you're fine. Then what's going to happen, Wendy, let's say you work 2 years later, then you're going to come in under a different enrollment period called the special enrollment period. And it requires a little extra work, not a lot. If you work with us, we do it for you anyways, but we have to verify that you've had credible coverage back to 65. So here's what I want you to know, Wendy. If you keep working past 65, it is fine. But if you change jobs, do not go without active employment insurance. And COBRA doesn't qualify, okay? So be sure you have active employment insurance. If you change jobs and you're going to be without, then you've got to go on Medicare for a month or two, and then you can go back off of it. But that's the key to being eligible to come into Medicare at a later date is credible insurance through an employer plan, you or your spouses, back to 65 with no gaps in coverage. And COBRA doesn't count. Okay, so that's the only key. So just keep working, covered by plan, you'll be just fine. All righty, let's keep going. Next. Okay, here we go. Next one. Okay, in Oklahoma, is getting medicine from the Indian tribe considered credible drug coverage? You know, I think it is, but do not quote me on that. I have never had that question before. I have read about some of that before. So what I would do is ask that organization if indeed it is credible coverage. They'll know that for sure, but I think that it is. But please double check on that. All right, I only have Medicare A right now. The hospitalization, I need to know what I need to do to get the best care for myself. Okay, so you're talking about like beyond Medicare A. If you best care, to me, I think you're asking me what can you do beyond the A, then you can enroll in Medicare B. Now, if you're still working and you have a good employer plan, and it's 20 or more employees, you don't have to take B. But if you're not happy with the employer plan or you're getting ready to retire, then you want to add Medicare Part B, then let us help you do that. In fact, I would just call in. We have agents right now. You call in, the 800 number, you see it on the bottom of the screen here. Call in and tell them that you want something beyond A, and then the agent that works with you will show you exactly how to get that B, walk you through the process, and then talk about your other insurance options. You may want a supplemental plan if you can afford the premium. If not that, then you can get an Advantage plan. So there's other ways to get something beyond Part A, and we'd be happy to help with that. Okay. Hopefully I answered your question. All right. Next, Tom from Ohio. Good to see you, Tom. Martin. All right. Thanks for letting me know where you're all coming from, and I'm sorry that I am all alone tonight. Here we go. What are the things to consider when changing your Part D carrier? Well, first off, the most important thing is the formulary. Are the medications that you're on covered? That's number one. Number two, what will be your copayments or your out-of-pocket expenses for those medications? And we always, of course, look at the annual cost, combine premium and the copayments. Is the pharmacy that you want to go to, are they considered a preferred pharmacy where you usually get better pricing, or will you have to change pharmacies and go with another pharmacy? Sometimes you have to do that. They all have the same max out of pocket this year, $2,100 for 2026. So I care about formulary, I care about copays, I care about my premium and the pharmacy that I can go to. That's how I would make that decision. And remember, you can always change your plans year to year. All right, just signed up for Medicare in April. Want to know if I need to make any changes. Well, probably not. If you've just been on for a few months, you would have gotten your Med-Sup plan was locked in for a year. Now, if you have an Advantage plan, then you most certainly want to make sure that you're still on the Best Advantage plan. So I'd call in if that's what you're on right now, and we can double check on that. But if you have a supplemental plan, then I can assure you you're probably on the very best plan because you chose that plan. But you probably also have a standalone prescription drug plan. So that plan you're on, you have to make sure it is the best for you for 2026. So don't assume it is. It may be, but do your due diligence. And the way to do that, the only way you can do it today is to go to Medicare.gov and put your meds in there. They may already be there. You'll give them your Medicare number and sign in, and then you can look at all the plans available in your zip code. So take the time to do that. So make sure you're on the right Part D plan. Otherwise, nothing else that you have to do. All righty. All right, thanks for letting me know where you're from. I love to see all that. Okay, Marvin, you recommended that federal government retirees recently turned 65 who are keeping FEHB and are getting Part A also like Part B. Can you explain why? Well, here's the reason why. Because if you elect Part B, you probably have FedBlue or GEHA. That's the most common. But I know both of those companies will give you a credit back on your Part B premium. I think it's about $800. And so take 800 divided by 12, so that's about $75 a month already that you saved on your Part B. So that's number one. Number two, I like it because if you don't take Part B now and you decide you want to do it at a later date, you're going to be penalized because for every 12 months that we go without Medicare Part B, even in your situation, when you don't have to have it, you're still subject to the penalty. So for every 12 months we go without Part B, when we were eligible to have it, then we're penalized 10% that's added to our Part B premium. And so if you go 2 years, it's 20%, 3 years, 30%. And so down the road, if the FEHB were to change their system in some fashion and you have A only and want to pick up B, you can only add it the first quarter of the year and you're going to be subject to those penalties. Thirdly, what I think is a better deal is if you keep FEHB and you have A and B, then A and B is going to pay first, FEHB is going to pay second. And so you'll probably have very little out of pocket in that scenario. But if you have A only and don't take B and you have some kind of serious health issue, FEHB is going to pay first on everything that B would have covered, but you're going to pay second. And so you're going to still be subject to out-of-pocket expenses for everything that would be doctor-related or outpatient-related. All right, and so I've seen plenty of people who did A only with FEHB and regretted that again because of the penalties, and so that's why I'm suggesting it. And then also what a lot of FEHB people are doing today, if the premiums are reasonable, very reasonable, they'll enroll in A and B, keep the FEHB with Blue Cross, get $800 from them, enroll into an MA only plan. That's Medicare Advantage only plan, and FedBlue will coordinate benefits with the MA only plan, and the MA only plan will probably give you $130, $150 a month back towards your Part B premium. So combine what FEHB gives you and the MA only plan, and you've got a very, very attractive package financially. So that's why. So there's multiple reasons, and if you don't do it, I'm not saying that's a crazy, dumb decision by any means, but I think the best decision is to take A and B for those reasons. All right, hope that helped. Let's keep going. And it says, and I would think your FHB coverage may have an effect on that decision. And that is so true. Very, very true. In fact, we had somebody today that I was on a live event, 1 o'clock, and their it's husband and wife, FHB premium combined was a little over $900 a month. I'd come off that totally. That is way, way too high. You can beat that on the normal Med-Sup market any day. So that's a good comment. I agree with that. All right, turn 65 in September. Now in UHC Advantage plan, if I don't do anything by December 7th, do I lose my only chance of going into original Medicare? No, not at all. Not at all. Okay, so let's talk this through. So what happens when you start an Advantage plan? You actually have what's called the 12-month trial right. So you actually have from September all the way up until next August to be able to return to original Medicare and get a supplemental plan with no underwriting. Okay, so you have that right. Plus, let's say you decide to keep your Advantage plan for 3 years. Then what happens is every year there's 2 opportunities for people to get off an Advantage and return to original Medicare. October 15th to December 7th now, and the first quarter of every year, January 1 to March 31. You can go back to original Medicare, but here's the kicker. In that scenario, your trial right is over, and now in order to move back to original Medicare and get a supplemental plan, now to get the sup plan, you have to medically qualify. Okay, so at this point in time, you have not shot yourself in the foot whatsoever. But when people stay on that Advantage plan for over a year, and now they want to get a supplemental plan, if they can't medically qualify, they're going to have to stay in the Advantage system probably for the rest of their life. Okay, but right now, you have not hurt yourself yet. Okay, hope that helps. Let's keep going. All right, is it possible that the Part D drug plan quoted to me by Evan today might not be the best plan for me when I sign up for enrollment as of August 1, 2026? Might there be better cost of plans at that time? No. Let me explain why. Because all the plans that are available for 2026 are out. Okay, so come August, there's not going to be a new plan. All those plans have to come out by October 1, and they're all out now. And all those are for the 2026 plan year, so there will be no changes. Now, it could be that the plan he put you on may not be your best option for 2027, but we're not there yet. And so this time next year, then you'll confirm to make sure you're on the right drug plan for 2027. So the plan Evan put you on is the best plan for you, for your meds, for your pharmacy choices, for sure, for 2026, because they don't change. There will be no new plans added until this time next year. Great question, though. Thank you. All right, can I get back on Medicare after I had an Advantage plan? Yes, you can. You can always go back to original Medicare twice a year, October 15th to December 7th, and the first quarter of every year. But the issue is, can you get a supplemental plan if you want one? And if you've been on the Advantage plan for more than a year, then you're going to have to go through medical underwriting. And you may be able to do that. I always tell people you don't have to be ready to run a marathon to be able to qualify to change med sup plans. We change people all the time. Now, if you have a serious health issue going on, you have dementia, or you had Parkinson's disease, or some serious neurological disease, or you're in the midst of cancer treatment, or you're an insulin-dependent diabetic that's has neuropathy or retinopathy, or you have rheumatoid arthritis, then all those things could keep you off of a med sup plan. But you do have the right to at least apply for one, and carriers look at people. Some carriers are a little bit more strict than others. We're brokers, so we typically try to find someone that we think that we can get you approved through underwriting. But you can go back after you're on an Advantage plan. You really can. Anytime original Medicare, the question is, can you get that supplemental plan? And if that's what you're concerned about, call in. You can talk to one of our agents, and they'll let you know rather quickly whether that's possible or not. All right, great question. Thank you very much. All righty, I signed up for an Advantage plan in New York. This is my third year. I'm interested in checklist and what changes are coming from 2025 to 2026. Okay, well, of course, in New York, it's an open enrollment state year-round. So if you decide that you, of course, want to return and get a Medicare supplemental plan, you can do that without any underwriting in the state of New York. So as far as Advantage plans are concerned, what you want to do is you want to be sure to compare. And I know there's limited options in New York, but if you haven't done your due diligence yet and you want some help with that, just call in and tell one of the switchboard operators that you would like to look at MedSup options for 2026. They'll transfer you to an agent, and they can go through all those with you. That's the best way to do that. We're happy to do that. No problem whatsoever. All right, let's keep going. 69 in good health, and my Advantage plan canceled. Good time to make more expensive move to Medicare with Medigap. My doc is out of Medicare and charges concierge pricing. Well, again, if a doc has opted out of Medicare and concierge, then you'll always have to pay that doctor cash. And so as far as wanting to go back to original Medicare, if the MedSup plans are affordable for you, then I always think that's the best option. And folks, I like Advantage plans, but there's a couple things about them that are problematic. Pre-authorizations, networks, and the plans change every year. And what we find is that fewer and fewer doctors are taking Advantage plans. Fewer and fewer hospitals are taking Advantage plans. So you could have some network issues. So if you want to get out of that system, to avoid pre-authorizations and have almost unlimited choices for docs and hospitals, then this would be a good time of the year to do it. You can do it this time of the year, and you can also do it the first quarter of next year. January 1 to March 31, people can return to original Medicare and get a supplemental plan. Of course, you're in good health, so I'm assuming you can qualify. Hey, I've had people that said, hey, I'm going to go on Advantage till 70, I'm going to switch at 70, and then at 69 they had some serious health issue and they never got to switch. I've had that happen before with people with melanoma. Very, very sad when those kind of things happen. They get cancer, and then now eventually melanoma, if you've been cancer-free, treatment-free within 3 to 5 years, you can probably qualify again. But it does take some time once you've been diagnosed with that. Okay, so that's the risk that you run, and you're going to have to decide if going to a supplemental plan now is in your budget. If it is, and you're healthy, I'd certainly do that. All righty, birthday. 12/26/1960. I've been on Medicare since 2011, right? So you came through disability. I'm having a couple procedures in December. I've met my co-insurance for the year. Am I going to have to pay the deductible again? No, not at all. So I am assuming that you must already be on a supplemental plan. And so what's going to happen, and let's address it as though you're on a supplemental plan. So what happens if you've already met your deductible for the year, even though you're now eligible to get a different plan, that same deductible is going to apply. So you don't have to worry about that. But one thing I would encourage you to do is this. I don't know where you live, but I do know that in most states, if you have a supplemental plan and you're underage, meaning you're not yet 65, many times those come with a higher premium. So what you can do without any underwriting, you actually can apply for a new MedSup and just get normal 65-year-old rates, and it's probably worth your time to do that. You get to reset the clock and call in. We can take care of that for you, and then what can happen is you can get whatever plan you want. Let's say that you want to get a G plan. What I would do is I'd make that G plan go effective, or an N plan, either one, make it go effective 1/1 of 2026. Keep the plan you're on now through the end of the year. That way there's no disruption at all in your services. And you wouldn't have to repeat the deductible anyways, but it would probably be a smoother transition to keep what you have now, make everything else go into effect 1/1 of 2026. But be sure to check those rates, because you may have had to pay a higher premium on those MedSup rates if you were on that MedSup plan. Most states allow the carriers to actually charge more. But once you're at 65, you can get a normal 65-year-old healthy rate. They can't rate you up any longer. Okay, so you have the window of opportunity to do that. And again, call in. Our agents would be delighted to help you make sure all that's done correctly. All righty. Does the supplemental plan G have the yearly deductible? Yes, G and N both. You're responsible for the B deductible, not the A deductible. That's covered. The one gap that the G doesn't cover is that B deductible, and that's $257 this year. We don't know what it'll be next year yet. We're expecting it to go up a little bit, maybe $265, $270. I'm not really sure, but it does have that deductible. And it's really not the G plan charging you that. It's Medicare charging the deductible. It's just that the G is not going to cover that for you. So you're responsible for it on the G and on the N. All right. So what's the phone number to call for an appointment with your representative? I'm referring a friend to you. Okay, well, it should be coming across your screen. I hope it is. We have several 800 numbers. Let me just give you the one that I always use. It's a different one from the one I can see on the screen, but they'll both get you to the same department. 800-864-8890. That's 800-864-8890. Okay, or the one on the screen is an 833 number as well. So either one will work. And we're open until 7 p.m. tonight. We're open Monday to Thursday, 7 to 7, Friday, 7 to 6. Okay? All righty. I understand how to pick the best plan for my current needs. How do I know if my plan will cover me if I get cancer or something else where I don't know what it would be and need expensive meds? Okay, you're saying you understand how to pick the best plan. Okay, all right. So the way I would look at that is this. If you can afford a Medicare supplemental premium, and some people can, some people can't, some people don't want to, but if you can afford a MedSup plan, that premium, then that is definitely going to be, in my opinion, your best coverage. Now listen, that doesn't mean Medicare Advantage is lousy coverage. I'm not implying that. I'm not. But what I do know is when people have serious health issues, they normally will spend more money out of pocket on their Advantage plan than they would have all year on their premiums for their MedSup plan. Plus, with the MedSup, that MedSup company cannot interfere in any way, can't delay, can't deny, cannot put any kind of pre-authorization on you. Plus, you can go to any doctor that takes Medicare. So your choices for doctors and hospitals are almost unlimited. So if you're looking for the best care, the way I see it is, I want as many docs to choose from, I don't want to hassle pre-authorizations, and I just want to pay a premium, not worry about being nickeled and dimed to death. Okay, I don't want to worry about any of that if I have a serious health issue. So that's why I would lean towards and favor a supplemental plan if you can afford the premium. If you can't or don't want to, then find the best Advantage plan that you can. All right? Okay, on supplemental plan. Now listen, folks, I am going to sit down. I have a terrible back. Those of you that follow me know that I struggle with back problems, so I can't stand any longer. I was raised in a small town, and we all hauled hay. I hauled a lot of hay as a kid, and so my back is not good. Hang on, just a second. This thing's a little bit crooked. All righty, here we go. I'm back with you. Okay, on supplemental plan in New York, receive bill from vascular doctor for $60. Isn't the max for copay $20 no matter what? Why are they charging? Okay, the only reason that you would be getting a larger bill than the $20 copay is if you have not yet met your B deductible. Okay, and so if you're still meeting your B deductible, that $257, that could be why they charge you $60. Now, if you have met your B deductible, do not pay that bill. Just don't pay it. What I would do is I'd call your supplemental company and let them know you got the bill for $60, why'd you get it, and let them tell you exactly what's going on. But again, if you've met your B deductible, don't pay the bill. If you haven't, I'd go ahead and pay the bill. Sorry, here we go. I turned 65 in March. I'm still working, plan to remain on my company insurance. What is the best course of action for me? I do not plan to retire until 2028. Okay, what I would do is this. If you're still working and you have a good group plan, the coverage is good, the network is good, the premiums are all good, as long as there's 20 employees on that payroll, then you don't have to do anything at all with Medicare. You don't have to do A, you don't have to do B at all. And so if you want to keep on working and you're going to retire, in a couple years, that's fine. Just make sure that you never go without some type of an employer plan. So if you change jobs in the next couple years, be sure there's no transition where you're without active employment insurance. If you are going to be without active employment insurance for a month or two because you change jobs, go on Medicare A and B. And then when you pick up that second job, that other job, and it's if you have great coverage, then you can drop the B. And that way, whenever you're ready to come into Medicare at a later date, what we have to do, we have to verify credible coverage back to age 65. And credible coverage does not mean COBRA. It means active employment insurance of you or your spouses, okay? And so now, if you are not contributing to an HSA, what I would do is I would go ahead and enroll into Medicare A only. And you can do that right after December 1. It's fine, folks, to have A only unless you have an HSA, because if you have A only, you can no longer contribute to an HSA. And so, again, if you don't have an HSA, take A only. You can enroll after December 1. And when you're going to, you go to ssa.gov, set up an account, takes you 10, 15 minutes, and then enroll into A only. So when the question comes up, do you want B? Say no. I don't want B. Now, when you say no to that question on the application, it'll flash and say, hey, you sure you don't want B? You're going to be penalized, and you will not be penalized as long as you have a good group plan. And folks, think about it. The government is grateful that you are going to keep working and they're not responsible for you. That's why they make it so easy for us to come into Medicare at a later date as long as we've had active insurance back to 65. No problems, no penalties whatsoever. Okay? Hope that helped. Let's keep going. All right, I'm on generic high blood pressure medication, got it through GoodRx, good, paid the same as my former employer's health insurance. That's great. Hey, I think GoodRx and Single Care, Mark Cuban's group, Cost Plus Drug Company, those are wonderful platforms to save money. But never think that those are a substitute for Part D plans, because they're not. They're great for generic medications, maybe occasionally brands, but usually not. They're great for generics. What you want a drug plan for is in case you got cancer or you had some serious health issue and you need a medication that costs $10,000, $20,000 a month, and they're out there all over the place, and now you only have to pay $2,000 a year for those meds all year long. That's why you get a Part D plan, not for what you're taking now, but what you could take. So I'm glad you know how to use the GoodRx. I love GoodRx. I love Single Care. Those are great things, but again, they're not in lieu of a Part D plan. All right, I turned 65 this past March. I'm currently on an Advantage plan. Can I change to a supplemental plan and will be penalized for doing so? Also, what's the, okay. Well, first off, the Part B premium, we don't know yet. It's not been announced that I'm aware of. We think it's going to be $206.50, but that's not official. That's the answer to that question. So as far as you going and get a supplemental plan, you can do that. And this would be really the good time of the year to do it, but you're still eligible to do it up until February of next year. And so here's the rules. When you start Medicare at 65 in every state, and you start with an Advantage plan, you're in a trial right. And during those 12 months, you can return back to original Medicare and get a supplemental plan. So yours would have been March 1 all the way to the end of February. But if I stay on the Advantage plan longer than the year, my trial right is over. And now, in most states, you got to medically qualify to get a supplemental plan. All right? So you're not going to be penalized for doing so at all. It's just that if we wait more than a year, we have to go through underwriting. And if you're healthy, should not be a problem. If you have health problems, then I wouldn't let that year expire for sure. All right. Okay, folks, I'm sorry. Here we go. All right, I buy a G plan in Connecticut and move to Texas. Will I be able to transfer my address to Texas? I'm told that I may have to undergo underwriting in Texas if the carrier has a different legal entity in Texas. That is not true. Yeah, whoever told you that, full of garbage. That's just not the way it works. When you bought that supplemental plan in any state, it is a lifetime plan. That insurance company has to cover you for life as long as you pay the premium. It's portable, you can move away, take it with you. So when you move from Connecticut to Texas, what's going to happen is that insurance carrier does have one right, and that is they do have the right to adjust your rate. Now, moving from Connecticut to Texas, your rate's probably going to go down. I have seen that happen before. But because Texas rates are definitely less than Connecticut. Connecticut is a community state, open enrollment year-round, so it's a whole different situation than Texas. But you can take it with you. So you just call the carrier that you're with, let them know you'll be moving, or once that move has occurred, give them your new address, new banking information if you're paying through a bank draft, and then see if they then will adjust the rate. Now, what I would do if I were you, if they don't adjust the rate favorably, why don't you call us and let's see what the market is. So if you're healthy enough, then you may be able to pick up a new plan in Texas. And the Texas rates are really very, very attractive, very good. In fact, all over the South and Southwest, Southeast, excellent rates for MedSup plans. So if you're going to call in, we'd be happy to help you with that. All right, let's keep going. Okay, talking to my PCP about supplement, replacing a lot of medications that damages your internal organs. That's good. Well, just be sure that you make this drug switch, your drug plan switch by December 7th, because after that, you cannot switch a drug plan. So I'm glad you're doing that, and I think it's wise to have your doctor reevaluate all that. The other day, I had a lady, that was taking, I think she was taking almost like 20 prescriptions daily. And that's really unfortunate. She had some health issues, but boy, that seems like a lot of meds to me. All righty, let's keep going. If you have a 100% military disability plan, what Medicare plan outside of A are required? Well, really, there's nothing required beyond what you have there. Now, I will tell you what a lot of people that have VA benefits will do is they will enroll in A and B and get their meds to the VA, but so that they have a civilian option outside the VA if they ever wanted it, then they get an MA-only plan. So you use the VA when you want, and you have a civilian option when you want, and that Medicare Advantage only plan will give you a credit. Teresa, it could be $150 a month towards your Part B premium. It's called a give back. And so you enroll in A and B, you got the premium on the B side, but again, they're gonna give you a sizable amount of money back on that, and then you get all the perks that come along with that Advantage plan. Again, you gotta get your drugs through VA, but now you have a civilian option for hospital and outpatient services, and the gym membership, the over-the-counter cards, the hearing aids, all those kind of things that you're not going to get through the VA, then you can get through your MA plan. And there's a lot of people. Those are called Patriot plans, Eagle plans. So they're great. We write those. So Teresa, you just want to call in, ask for an agent, and say you want to talk about one of those MA-only plans, and they'll tell you about the details, and we're happy to help you get set up with that. But you do have to be enrolled in A and B to do that. But again, that B premium is going to be reduced drastically by that MA-only plan, giving you a credit back on your Social Security check. All right, let's keep going. My drug plan isn't available anymore. It was Cigna prescription drug plan. I'm in Leavenworth, Kansas. Okay, let me tell you what you want to do. Go to Medicare.gov, please, and you can you have to put your meds in there. And what's interesting about Kansas this year is Blue Cross Blue Shield has two very low-cost plans. I forget the name of them, but one of them is 0 premium and one is 70 cents. And they have other plans as well, typical WellCare, some of those plans, but that's what I would do. So again, go to Medicare.gov, and both of those Blue Cross Blue Shield Kansas plans are in that platform. And I think they cover Leavenworth. I'm pretty sure they do. I think it's a Blue Cross Blue Shield, fully Kansas, or at least Eastern Kansas anyway. So that's what I would do. Medicare.gov, look at the plans, and look over those two Blue Cross plans. All right, next. Okay, how often should you look at changing your GAP plan? Well, usually the first couple of years, your rates are going to be, fairly stable. We just tell people that you can shop it anytime you want to. In fact, if you want, let me give you all a website of ours. If you just want to look at rates without any kind of hassles, go to medigapcompare.com. Medigapcompare.com. We own that site, and this is a tool that we put together for our clients. You can go in there, and what it does is you'll give them your date of birth, your zip code, and what it'll do, it'll actually shop all the plans in your area, and then it takes the lowest 3 premiums and it'll give those to you. There could be 10 plans, there could be 12 plans in your area. It'll give you the lowest 3 companies in your market. And so you know what you're paying now, and so if there's going to be a better price, then all you have to do then is you can actually answer the health questions, and then our agent would reach out to you and complete the application. It's very simple, very smooth process. In fact, I think when you talk to the agent, it takes about 10 minutes. So you do all the stuff on our website, medigapcompare.com, and then we're happy to assist you with those final steps. Okay, so that's what I would do. At least you'll know if you're in the money or not with your prices. Hey, I talked to a guy just yesterday, a client of mine, been a client of mine for years, and we were shopping rates. And we looked at the market, today's market, with what he's paying, even though he's been on the plan a while, and there was no one better. In other words, his company was still stable, and that happens. Sometimes companies are that stable, you don't have to worry about it, but it never hurts to check, and if you can get qualified, then you can make a move if it'll save you some money. Alrighty, on a plan end, some doctors charge what is called excess, 15% more. Okay, so I don't know if you're answering a question. But yeah, so you're right. If there is an excess charge when the doc adds 15% to the Medicare approved amount, the end plan would not cover that. Now, excess charges are frankly very rare. They can happen, they do happen, but not often. Doctors have to tell you if they charge excess. You can find out in advance. You just have to ask them if they take assignment. There's 8 states that do not allow it. So again, they don't happen often, but you're right, the end plan would not cover excess if it occurred. All right, can I get a supplemental plan and use TRICARE for my drugs, or do I have to get an MA-only plan? Okay, Greg, in your situation, I would not spend money on a supplemental plan. I love supplemental plans, okay, but you don't need one. You really don't. What you want to do, you have A and B, you have TRICARE. If you enroll in an MA-only plan, then what's going to happen is TRICARE will coordinate with that MA-only plan, and that really is your best deal. It is. You'll have a good network. TRICARE will pick up all the copays, that you would be responsible for. You get that give back on your Part B premium, increases your Social Security check or reduces your Part B bill. So that's what I would do. You just really don't need a supplemental plan because you have TRICARE. That's the reason. I rarely tell people they don't need a sup, but with you really don't. It would just be way too much insurance, and it would not be in my opinion, a good use of your money. Okay, so I do A and B with TRICARE only, or I do A and B and get it into an MA only plan with TRICARE. That's the way it works. And the good thing is, if you don't like the MA only plan, you can always go back to A and B with TRICARE. It's not like you're ever going to lose your TRICARE benefits or A and B. All righty. I have 3 total meds. All 3 are inexpensive. Should I be concerned? And check that as well. I still would, Kevin. I had a guy the other day that was on that WellCare plan. It was 0. And here's his exact words to me. He said this. He said, well, even if it goes up a couple dollars, he said, I'm fine. I'm not going to hassle with it. And that was all right. I looked at it because I was curious. And in his market, his 0 plan went to $9.60 a month. Now, is that a big deal? No, it's not. But what else could have changed? It could have been that those 3 inexpensive meds could have been re-tiered, and maybe they'll be a little bit more expensive. So I would rather go back, do my due diligence, and make sure I'm still on the very best plan. So do that. Go to Medicare.gov and check it out, okay? Because your plan, it may be the number 1, but I still make sure. Doesn't take long to check it. All right, can you talk about Medigap, please? Yes. Hey, and by the way, I'm going to tell you about Medigap, but let me tell you something you could do. If you want to go to our website, it's medicareschool.com, medicareschool.com, and there is what we call the Essentials Workshop. It's a free workshop. I do a new one every year because Medicare numbers change every year, and it's about, I think it's like 48 minutes or 50 minutes. And I will tell you, you will learn so much in that workshop. I cover really all the ins and outs, all the details, and you'll learn a lot. And just basically, Medigap policies are filling in the financial gaps that Medicare does not cover. And this is the way to remember it. Medicare doesn't cover anything 100% except for preventive services. That's it. A wellness checkup, shingle shot, Hep B shot, flu shot, certain screenings covered by Medicare 100%. But everything else, which is 99% of all services, you're going to have a balance to the bill. That's called a gap. And there's deductibles that are part of the gap. There's co-insurance. There's co-pays. So there's a variety of gaps. There's excess charges too. So you can get these you get these gaps covered by a Medigap policy, a private health insurance company that you can transfer the liability of those gaps to them. And when you transfer the liability to them, you pay them a premium. No different than our home insurance. We all have homeowners insurance. We're crazy if we don't. Why? Because our house burns down. We have to rebuild it. We have to pay to have it rebuilt. But if we have a homeowner's policy, we transfer the liability of that to an insurance company. We pay them a premium to do it. And so we have gaps in the healthcare business. And you're crazy if you don't have something. Honestly, folks, I'm not trying to be disrespectful here, but A and B only is crazy to me. It is, because you're taking on all the gaps, the deductibles, the co-insurance, and there's no limit. It just keeps going and going and going. This is why the second largest holder of all the Medicare medical debt in our country are people that are on Medicare. That amazes me. We have $230 billion in medical debt in the country. Okay, that's all age groups. And the second largest age group that holds that debt are people that are on Medicare. Why? Because they had A and B only, and they couldn't cover the gaps. Or they had a Medicare Advantage plan, and they couldn't, cover the max out of pocket. Just very unfortunate. Okay, so hope that helps. And watch my workshop. It'll really be helpful. All right, evening on a $1,000 spin down Medicare Medicaid plan. Why is this status is not considered dual for dual SNPs on a C-SNP? Now, the reason for that is because you have to be fully eligible for Medicare with no spin down to be able to be eligible for these dual SNP plans. You have some Medicaid eligibility, but you got to spend $1,000 first. I mean, that's like you have no help. I wouldn't do that for a second. So again, a chronic SNP plan or some other kind of Advantage plan would be your best option, because you're not dual eligible. Dual eligible people have no spin down. Okay, that's why. All right, there's just different statuses of Medicaid eligibility. So $1,000 spin down is really, you have no Medicaid eligibility. It's crazy. All right, how often or how many times can I put my FHB on a temporary hold? Well, you mean how long can you suspend it? Well, you can suspend it indefinitely. I guess what you're thinking about is suspending it because you're going to take a traditional Medicare Advantage plan. I know that's an option. And so, yeah, you can keep it on hold as long as you keep other insurance. You can go back into FHB anytime you want to. Yeah, no problem at all. I don't know under what circumstance you're suspending other than Medicare Advantage plans. Maybe there's something else I'm not aware of. Maybe it's because of TRICARE or something, FEHB, or maybe a spouse or something has FEHB. But regardless, if you can suspend it, you can keep it suspended. All right. Still waiting a few days or short month to hear if Cigna approved my plan and application. Do they not have an obligation to relay approval in a reasonable amount of time? You know what, Cheryl? It is frustrating. We're so frustrated with them right now. I think they're a good company, but what's happened is them and another carrier have been really the most competitive in the country, and they're just writing so much business they can't keep up. And so, and if you're with us, I'm sorry. I mean, their rates are excellent, but we're waiting patiently as well. And as far as an obligation, they do, but there's no one can force them. You don't have an obligation where they set an exact date. We just have to keep waiting. And Cheryl, if you want to change that, if you're with us, just call in and let the agent know that you want to switch. There is another carrier that's very comparable to Cigna, and so we can always move you. But I'm not bad-mouthing Cigna either, because I still think it would be a great company. But when Healthcare Service Corporation bought them earlier this year, I don't think they're really anticipating being this successful, writing this much business, and that's why they've gotten behind. Okay. All right. I know that didn't make you feel better, but again, if you want to switch, let us know. We can find another carrier that'll be comparable. All right. I was getting a call when you talked about the Medicare Advantage plan and you talked about the max out of pocket and copay, but I didn't get the rest of the information. Okay. Well, with Advantage plans, the way they work is you pay copays and coinsurance till you hit the max out of pocket for the year, and that varies. Some plan it's $3,000, some it's $5,000, some it's $9,000. And so what I was saying is that some people that have an Advantage plan that are concerned that they don't have the money if they did get a serious illness, they don't have that max out of pocket stored away in a savings account or something, then they will buy what's called copay protection plans, hospital indemnity plans. Those are synonymous to help offset some of those out-of-pocket expenses. Critical illness plans for cancer, stroke, heart attack. Those conditions cause people to max out. So if you don't have that max out-of-pocket money, you can't afford that, then get a small premium to get another insurance policy to cover those expenses for you. That's what I was saying about that. Call in. We write them all the time. Happy to help you to see if you can get on one of those. All right. Here we go. I stay with Cigna Wellspring this year. My expense will be around $4,500. Going to Aetna, it will be $2,500. All this for one inhaler. Seems insane when I see people on 6 drugs paying $500 a year total. Yeah, okay, so yeah, you're probably on definitely a brand name. But here's the thing. What I would do if I were you is this. The max out of pocket, as long as the inhaler is in network, is $2,100, okay, out of your pocket. So what I would do is I would enroll in the least expensive drug plan in your market as long as that inhaler is covered. You may be able to find a plan that's $10 a month. So you're going to pay $2,100 for the whole year for the drug, $10 a month. So anyways, that's the way I would handle that, because as long as in formulary, you're still going to max out. So if I know I'm going to max out, I'm going to take the lowest cost plan on the market as long as my as long as my drug's in formulary. That's the way I'd handle that. Okay, or change inhalers. And I know some of these are tough, especially if you have COPD or emphysema. There's certain ones that really, really work well, and I know they are expensive. And that stinks, but it happens. So sorry about that. I hate that for you. Okay, got my IRMA letter from SSA already. Well, that's good. I'm glad to hear that. Good to know that. That's interesting. If you got the IRMA letter, that means they've set the IRMA thresholds. So I'll have to do some research on that. I didn't realize that the thresholds have been set. So, hey, thanks for letting me know. Appreciate it. All right. I heard that Washington State is going to start requiring pre-authorization for some things in 2026. Can you confirm that this is true? Yeah, well, it's not Washington State. It is actually Medicare. And there's 6 states that are going to be part of a test program. and Washington is one of those. But I will tell you this, you all, I looked over that list. I think it's like 19 different services, so it's not very many. Medicare right now has 12. I think they're adding 19 on these 6 states. But all those things, if you would look at the list, you would see exactly why they're doing pre-authorizations on those. Most of those services were highly abused by the providers that do those particular procedures and surgeries. The DOJ department found a lot of fraud, waste, and abuse within those services. That's the only reason they're doing it. And I want to let you know something. Listen, if a doctor in Washington doesn't want to do a pre-authorization, they still don't have to do it, but they will just have to provide proof after the surgery, the procedure, why they did it if they want to get paid. But if they want to be guaranteed to be paid, that's when they do the pre-authorization. So some docs still won't pre-authorize it, and they'll still get paid because they know it's justifiable. They know the Medicare system. So I'm just saying this to all of you. I would not make a big deal of these additional procedures that Medicare is doing for pre-authorization. It actually helps all of us because it's going to help reduce some of the fraud, waste, and abuse, which helps control our Part B premium. So it's not a bad deal. It really isn't. It's not like an Advantage plan that 27% of the time is going to have a pre-authorization. No comparison. In fact, you do the math on it, it's like less than 0.5% or something. So it's minimal pre-authorization to the Medicare system. And those that are, by the way, being added are already pre-authorized by pre-authorizations under the Advantage system. So it's not a bad thing. I promise you it's not. It is not. All right, let's keep going. Whoops. All righty. Okay, these are people that were earlier saying they couldn't see me. So we'll get through those. All right, let's keep going. Any questions? Sorry, you all. I'm scrolling. And I am sorry for that technical difficulty. I'm sure it was my fault. Okay, I heard, we covered that one. We already got that one covered. Y'all, I'm really sorry. Here we go. Everything being spoken is being broadcast in duplicate. 1 second part. Oh, boy. I'm sorry that I created a problem here. Here we go. I currently have a prescription supplemental plan, but going with Devoted next year. I also have a prescription plan through Cigna. Do I need to cancel the 2025 coverage? Okay, here's the way it works. So you have to cancel your supplemental plan effective 12/31. You have to. We can't do that for you. You've got to call in. I would call in, mid-December or something, and cancel it. Tell them you're going elsewhere, and you want the plan canceled, midnight 12/31. All right, now when it comes to your Cigna drug plan, no, because what happens when your Devoted plan will automatically kick out the Cigna drug plan. It doesn't kick out the supplemental plan, but it will kick out the drug plan because you only be on one drug plan at a time. So Devoted has an embedded drug plan, so that enrollment that you've already done, once that goes effect 1/1/2026, is going to kick out your Cigna drug plan midnight 12/31. That's the way it works, okay? So cancel this up. That's all you have to do. Alrighty, regarding Part D, specifics to deductible, satisfaction, and tier drug financial responsibilities, as always made to cost. What is the measurement for determining cost? Okay, cost would be your out-of-pocket cost, co-pays, co-insurance. So the premium, what you're actually paying for that. So I hope I'm understanding your question. So the cost would be, what we look at when we're looking at drug plans, we look at the annual cost. What are my co-pays, my co-insurance, and my premiums? What am I going to spend on those? That's the cost. Now, the cost for the meds is the only thing that applies to the $2,100 max for the year. That's deductible and my co-pays. The $2,100 max does not include the premium that I pay to be on the plan. All right? So hopefully that helps. FHB GIHA, standard with MA, is the MA primary over Medicare A and B. Okay. Yes, it would be. And anytime you're enrolled into an MA plan, then then A and B is still out there, but A and B, because the MA plan, MA does not pay, Medicare does not pay any bills. It pays a flat rate fee to the Medicare Advantage company. So that's why the Medicare Advantage company is now primary. When you have an MA plan, they're primary, and then GEHA would coordinate with them. If you weren't enrolled in an MA plan, Medicare Advantage plan, and you just had A and B, then A and B would pay first and would be primary, and then GEHA would be second. But when we do an MA plan, A and B is set aside, MA plan pays first, GEHA second. That's the order of payments. Hope that helped. Okay, what percentage of people sign up for Medicare when they turn 65 because they think they're required to by law? Well, a lot of people. I don't know the exact percentage. But it definitely happens, and so that's really unfortunate. Yeah, but yeah, I don't have a stat on that one right there. But most people here, even if they know they don't have to take B, they think they have to take A, or they'll be penalized, which is not true. If Medicare A is premium free, meaning you have 40 quarters of taxes paid in, you'll never pay a premium for A whenever you take it. No penalties on A. All right, but we encourage people that if you're going to keep working and you have a good group plan, if there's 20 or more, you don't have to do anything because Medicare is going to pay second anyways, and your group plan pays first. So A only is fine if you don't have an HSA, but if you have a great group plan, that's all I would do would be A. I wouldn't do B at all. Yeah, just because your group plan is going to pay first anyways. All righty. Here we go. Thinking of changing Part D for 2026. One prescription is supposedly covered but needs doctor confirmation. Yep, how can I ensure it will be covered? It has been covered under current plan Part D. Well, yeah. If you change plans, then you're right. You'll have to go back through the pre-authorization process. But I would tell you that if one plan pre-approved it, I can't imagine why another plan would not. And I understand, I know your hesitancy, I understand the risk involved with that. What you may want to do is to call the pharmacy that you use, and if you talk to someone experienced there, you may ask them their opinion about that. Say, I'm going to change drug plans, got to have a pre-authorization on this medication. Do you think I'll run into any trouble? And a pharmacist may give you their opinion about that, without recommending any plans, of course. So that's probably a way you could cover your bases. I do know this, that most authorizations are approved because Medicare wants these companies covering your meds. Some that are not approved, it just means there's generic equivalent or alternatives that are available first, and you have to try those first. And then if they don't work, then I could see them adding that drug to the formulary after you did the step therapy. All right. All right. Hi, Marvin. Thank you for sharing your wealth of knowledge. I signed up for Medicare A and B in September. My card is active, 12/1. Birthday is 12/31. Can I use my ACA plan in December? Okay, well, you wouldn't want to use your ACA plan in December because if you do, your subsidy is gone. Yeah, whatever premium tax credit you have, whatever reduced premium you have, those are gone. So don't use it 12/1. In fact, you need to cancel that thing effective 12/1. Yeah, because what makes ACA plans so attractive is the incentives, reduced premiums, premium tax credits, cost sharing, all that. But that's gone effective 12/1. Anyone that's eligible for Medicare, if they have an ACA plan, all the incentives are terminated on your birth month. Okay, so don't use it. Use your A and B and your MedSup plan. Okay, original Medicare 10/1. WellCare scripts, I believe, is I don't take meds. At this time is your favorite phrase, but money is tight. Better choice, G or N. Well, money's tight. It would be a no-brainer for me. I would do an N for sure. Folks, N plans are fine. They are. I mean, the risk of excess is minimal. And you can eliminate that risk altogether if you ask if a doc takes it, okay? And then $20 copays. You're going to probably save $40 to $60 a month on that plan. And so if you have a $20 copay, you're not going to go to the doctor 2 or 3 times a month probably. Now, if you do go to the doctor that frequently, then I would do a G plan. But if you go infrequently, then I would do an N plan, okay? All righty. How can I get my hospital indemnity plan or copay protection plan? Please help me. Yes, you see the number scrolling along the bottom. Hopefully you can see it. Let me give you another number if you can't see that one. It's 800-864-8890. 800-864-8890. Just call in and tell the reception team that you want one of these hospital indemnity plans. They'll transfer you to the right department, and we'll look at what's available in your area and give you prices and see if it's something that works. Yeah, just call in. We'll take care of you. We're open until 7. Let's see, we're open another 45 minutes tonight. Be open at 7 o'clock in the morning. And tomorrow we close at 6. All righty here. Okay, birthday 10/8/60. Plan to work to 67 as spouse credible insurance at our work. Good, live in Texas. Do I need to enroll now to avoid underwriting for a supplemental plan? No. Or will I be able to enroll with no? Yeah, okay. Yeah, you don't need to enroll into anything unless your spouse's plan, if there's 20 employees on the payroll or more, you don't have to do anything. Okay, 19 or less, you have to enroll to Medicare, because 19 or less on the payroll, Medicare has to pay first, group plan pays second. But as long as your spouse's plan has 20, it's not on the plan, 20 people on the payroll or more, you don't have to do anything at all, and you won't be penalized. Now, once she retires, I guess it was a she, retires, or whoever retires, then you need to get ready then to go on Medicare coming in during the special enrollment period. So as long as you have active employment insurance, yours or your spouse's, you don't have to do anything at all. Now, I would suggest if you all are not contributing to an HSA, it's fine to enroll into A only. There's no cost for A, just don't take B. Take A only. That way you're in the system, you got a Medicare number, and you can come into B when it's time for retirement here in a couple years. No problems. All righty. Uh-oh. I am really sorry here, folks. See if I can get back. Okay. Can you use an ACA plan along with Medicare? No, you cannot. No. There's no reason to do that. And the reason we lose all the subsidies, folks, is because you cannot get two federal subsidies at the same time. And anyone that's on Medicare is getting a subsidy because of A. And even if you have A only, you're getting a subsidy because you're paying no premium for it. And so it's reduced cost. B, of course, you only pay a portion of the premium. So no, you cannot do it. It will not work that way, I promise you. You have to cancel your ACA plan, and you should do so. I'm turning 65 in May. What is my next move? Well, what I would do is this. Go to my website, medicareschool.com, medicareschool.com, and please watch the Essentials Workshop. It's 50 minutes, and you will get a great education, learning what's going on. So that's your next move. Get an education first. Of course, you probably came through our Facebook or YouTube. There's a lot of videos we have and others have, but get an education first. And then you're turning 65 in May. If you're going to go on Medicare, back up the clock 3 months. So back up April, back up March, February. So what I would do if you're going to use us, call in January and get on the calendar, and we'll help you enroll into Medicare A and B. We'll shop sub-plans. We'll look at advantage plans if you want to go that direction. But really, just need a broker. And folks, keep in mind, you don't pay us anything. And there's no extra fee to use a broker. And with a broker, the beauty is you have options. You call an insurance company direct, they're not going to give you options at all. They don't work that way. We give you options, making sure you really are getting the best deal, the best coverage, the best price, all that. And that's what brokers do. And the price is all the same. If I quoted you a price right now, let's just say with Aetna, and it's $150, and you call that in direct, the price is going to be $150. There's no difference. We don't make the prices up. The insurance companies make those. They set those. We just simply write those products, and they pay us a commission. And the good news about us and any reputable broker, not only do we help you initially, but we help you the rest of your life. We have a customer service team. We invest a lot of money in that team, making sure our clients get help, that you're not having to be transferred into the Philippines or India or China or someplace to get customer service. It happens right here in our home office in Overland Park, Kansas. All right, I'm going to keep going. Okay. Well, y'all, I do not know why I can't get this to move. Well, it could be that I have no more questions. That seems awfully odd to me. Okay, good. How do I know what I need for Medicare? I have A and B plus AmeriHealth. Well, again, I don't know what AmeriHealth is. AmeriHealth, I don't know. Jeanette, why don't you call in and talk to one of our agents, and maybe they would be familiar with AmeriHealth. I don't know what that is. So call in, and then they can discuss that with you, please. Okay, I'm just not familiar with it. All right. How does the VA work with Medicare and Humana? All right. Well, my understanding is that when you have VA, they're not going to bill the insurance company. They're definitely not going to bill Medicare because they're two different government agencies. So the VA is self-sustaining. You go to them, they're going to cover, the VA budget is going to cover that. If you go outside the VA and you have, like, let's say you have a Humana MA-only plan, then that just simply means that you're getting that because you're eligible for Medicare. You have VA because you served in the military. You have Medicare because you paid into the Medicare tax system for at least 40 quarters. All right, so if you have an MA-only plan, then that's your civilian option. And so if you go outside the VA, then that Humana MA-only plan is going to help you with that, plus give you probably a nice sizable amount of money back on your Part B premium. So that's how that's going to work. So they really are two separate entities, and they're not going to coordinate benefits. Okay. All right, I'm going to keep going. WellCare is the lowest plan for Part D for me, and they're good and have good customer service. I would agree with that statement. You're exactly right. IFA Medicare recipient lost their Part B due to not paying the premium. Okay. What they need to do to be reinstated. Okay, well, here's the way that works. If you lost your coverage, then you can call Medicare and see if they will reinstate it with back premiums. And I've seen that happen. I've seen people pay back premiums for a year or even longer. If you don't have the money to pay the back premiums, then what you need to do is you can enroll into Medicare the first quarter of the year. And if you call in, our agents will guide you through that process. And if we do a January enrollment, then you can be reinstated in Medicare February 1. Now, for every 12 months, full 12 months, not partial 12 months, but full 12 months you went without Medicare B when you should have had it, then they can charge you a 10% penalty. Okay, but again, it has to be 12 full months. So 23 months would only be 10%. 11 months would be 0. So get the point, full 12 months, 10%. They charge that penalty added to your Part B. So if you call the agent, call us, and our agent will walk you through the process, let you know exactly how to do all that. Great question, thank you. All right, oh boy, I better repeat my question if I should change drug plan. Cigna, which was 41 plus per month, is going to, okay. All right, well, I'm not sure exactly what your question was, but I would agree totally. Yeah, I would get off of that plan. All you have to do is just go to Medicare.gov, put your medications in, your pharmacies in. It'll show you all the plans, and you pick the plan that has the lowest annual cost. That's all the medications you're paying, and the premium that you have to pay will be the annual cost. And that's all you have to do. And it's really a fairly good system. And the good thing is it's all stored in there from year to year. We used to have our own system. We used it up until a week ago. And then the plans started pulling them off of broker platforms, and that's why we all have to use Medicare.gov now. I wish they hadn't done that. I hope they changed that. It was a bad decision, but we got to live with it. Let's keep going. Presently, I have G with Humana in Missouri, but I may move to San Diego. My birthday is in June. Can I just change my address and keep Humana, because then I need to change my addresses in February? All right. So, yeah, you get to keep your Humana MedSup plan. You can. And so your birthday's in June. Can I just change my address and keep Humana? Yes, because then I need to change my address as if February. Okay, I'm not understanding your question, but the point is you can keep your Humana plan. The only thing Humana can do when you relocate, you give them your address, and if you don't, the Postal Service will anyways. Then they'll notify you, and then they do have the right to raise your rate in California. So what I would do if it were me is let's find out what that rate's going to be in California, and then once you've moved, then call us, and then we can reshop what plans are available in California for you, and you may be able to move. So that may be a good option for you. That's probably what I would do, especially since your birthday's in June. So I would make the move, let Humana know the address, see what the new premium comes in at, and then reshop that thing right around your birthday. And we can help you do all that if you want. Okay, here we go. On Medicare.gov, the first choices are at no premium. Is this reliable? Absolutely. Yeah. And folks, all that simply means is that company, see, they're actually getting paid by Medicare a monthly amount as well. So they put together a formulary and cover a certain amount of meds, and they're saying they can still make a profit margin even at zero premium. So yeah, don't worry about the zero premium at all. Yeah, you want to be on it. If there's a plan that's zero, take it, especially if you take no meds. Absolutely. On Medicare.gov, oh boy. Okay. Not sure what's happening here, but maybe we're out of questions. Okay, well, I'm going to assume that is the last of the questions, folks. I don't see anything else, so I'm going to call it good. I want to make sure you know that I do this every Monday at 5 and every Thursday at 5 o'clock, as long as I'm in town. Okay, so we'll always try to be here for you to answer questions. If we can do anything, please call us. And one thing about us, folks, you're going to get honesty and you're going to get thoroughness. You're going to get patience. I mean, it is a very busy time of the year, but our agents really are known for being thorough, being patient with you, and giving your options. So we'd be delighted to serve as your Medicare broker. Reach out to us if we can help in any way. And thanks so much for being part of this tonight. And next week, our Monday and Thursday, I won't be by myself, so hopefully it'll go much better. You take care, and thanks a lot. Bye.